I'm Dr. Baloo. I'm a psychologist from the Silm Center for Mental Health. And here we are at this webinar to talk about complex trauma and couples work. And here to talk to us about that is Andrea Hall and Danielle Gardner. And so I'll hand it over to them. And you guys, this is such an interesting topic. Of course, we think about trauma within the individual, but of course, there's so much impact that happens between the couple and also interpersonally with other people, right? People who were in your life before trauma happened, after. It's really interested to hear more from you both about this. So I'll let you take it away.
Thanks, Dr. Baloo.
Okay. All right. Well, good evening, everyone. Thank you so much for joining us this evening. As you know, we're going to be talking about couples, but specifically complex trauma in couple therapy. So my name is Danielle Gardner. I'm an MSW and psychotherapist at Silm, and I'm co-hosting this with Andrea Hall, who is also a psychotherapist and MSW as well. So we hope that you guys enjoy, and I guess we'll just get started.
Thanks, Danielle.
Okay, so the outline, we're going to first start by talking about some concepts, and then we're going to move into selected themes, and then some case examples to just get into some like more lifelike scenarios, and then we're going to get into different approaches, followed by, well, closing out with discussion and Q&A.
Okay, thanks so much, Danielle. So just to clarify a few concepts, really the title concepts of our discussion today. So what do we mean by complex trauma? So exactly the same as, when we're working with individuals, when we refer to complex trauma, we are referring to trauma that can be cumulative. It may be repeated or ongoing. Often complex trauma involves interpersonal relationships where there is a power dynamic. It might be developmental, so happening early in someone's life, and often it involves elements of secrecy and shame. That list is not exhaustive, but those are some of the key pieces that we think of when we're talking about complex trauma. Also, when we refer to couples, we are talking about diverse dyads, triads, groups, just diverse love relationships, diverse intimate relationships. So that could be folks that represent a variety of sexualities, genders, identities. There's no rules about the composition, the members, the norms of those relationships. So even though we're saying couples, we are referring to all different types of love relationships. So really what we're hoping to explore are the ways that the common effects of complex trauma reverberate through people's intimate relationships.
All right. So now we're going to jump into some common effects. So some common effects of that complex trauma within relationships or couples are avoidance is one. So that's basically relational, just disengagement. So just becoming just not interested, no longer interested in the relationship, and each other as well. Another way in which avoidance shows up is by social isolation as well. Then there's also emotional numbing, which is just difficulty experiencing or sharing emotion as well within the couple. There's also hyperarousal, which can show up as aggression, sleep disturbances. And then there's also the caregiver, the impact on the caregiver. So how a partner accommodates the other's impact of trauma. So basically, there's going to be one, there can be in some cases, one person within the couple that is experiencing some sort of trauma, right? And obviously, it's going to impact the other person in the relationship. So basically, how that partner accommodates the impact of that person's trauma is the impact on that caregiver, which is also another effect.
And just quickly, we also wanted to clarify when using these terms, right? Avoidance, numbing, hyperarousal, aggression. There can be so much, I mean, there is so much stigma associated, right? These terms sound so negative. So we really just want to acknowledge the impact of this clinical discourse around trauma. We know that the effects that people with complex trauma, the effects that they experience are adaptive. These are survival strategies. These are neurobiological ways that people have adapted to keep themselves safe. So we really recognize that the language, the clinical language that we have poses some challenges and some deficits.
Sure. Thanks. And then some additional considerations, like so other things that can also be co-occurring or that can happen are, abusing substances, self-harm, contemplation of suicide or psychosis, as well as abuse. Abuse can also show up in these relationships just due to the other stressors. They can be co-occurring. So we just want to bring that to the forefront as well, that these things also can happen. And then ways that we mitigate that risk is through, doing a risk assessment, safety planning, and seeking additional resources when required.
Okay, so the focus of our discussion today, we wanted to look at two particular ways that complex trauma can present for couples and the themes around that. So, and we're going to be talking about two case examples that represent these particular presentations. So one is with sexual abuse. There are a variety of things that we might see show up within a relationship, within a couple that we're seeing when one or both members have experienced sexual abuse. So there might be increased emphasis on sex. There might be avoidance or, quote unquote, dysfunction with sex. Sometimes there can be re-traumatization that happens within the couple. And very often there is shame. Shame from past trauma that presents in the current relationship. We're also going to present a case example that pertains to first responders. So, we in our work with couples, we see police, paramedics, firefighters, variety of first responders. And there are some, particular themes that we've noticed in working with that population. So the way that can show up, the effects of the complex trauma can be through, self-protection or being on guard, feeling self-blame or helplessness, a loss of identity and capacity, right? So when we think about first responders, these are often folks who are leaders in their community, who are people who are highly adept at intervening in crisis, to feel like they are on the other side of that, to feel helpless, to feel like they're lacking capacity can be extremely shameful, diminishing, and there's issues around like power and persona expectations, right? What partners can expect from their partner who is a first responder, where in one domain of their life they can have power and leadership and exercise that capacity, and yet in their relationship perhaps they are not able to because of the way that the trauma presents. So the first case example that we're going to discuss is Josh and Monique. Of course, these are pseudonyms. So both of these folks are survivors of sexual abuse. So Josh was victimized as a child by a sporting coach. So he has developmental trauma. It's historical. Monique was in multiple abusive relationships as an adult. So more recent, highly violent, whereas Josh's experience is, highly deceptive, manipulative. Power operates very differently in both of these experiences of abuse. So within the relationship, Josh experiences avoidance relating to sex. So difficulty experiencing and expressing arousal, right? So what that can look like is, difficulty physiologically being able to engage with sex, difficulty being able to express desire and wanting to be with their partner, but how that plays out, and shame around sex, right? Why am I like this? Why can't I be there for my partner? Why can't I please my partner? I'm inadequate, right? That is shameful. Monique, on the other hand, seeks sex as affirmation of love and acceptance in this safe relationship, right? So for her, feels a tremendous sense of being unwanted, feels rejection by Josh, and then there's shame in that rejection. So when Monique approaches Josh for sex, Josh deflects, Monique reacts, Josh feels criticized, Monique feels rejected, and then you can see the cycle of how that interaction plays out. So before we delve into approaches and how we're going to apply approaches to this case example, we are actually also going to present our next case as well. So I'll hand it over to Danielle for this one.
Okay, thank you, Andrea. So our next example, case 2, is, again, we're obviously not using real names, Raheem and Janelle. And both of these individuals are first responders. And as we explained, often with first responders, there can be a variety of issues, difficulty separating the work from the personal, or being a very different person in both of those, scenarios. So the effects can be, they can vary in terms of the effects and the way that plays out within the relationship. But both are currently off work due to PTSD. Both grew up in families that were experiencing emotional abuse. So, feeling like emotionally they were not safe within their developmental years and with their family. Couple experiences high conflict, so very explosive fights. So very, highly like volatile, high conflict. Features include blaming, name calling, threats to end the relationship, and defensiveness. They also both have expressed having difficulty being vulnerable with each other. So just being able to show that side to one another. It feels like partners compete about who has it worse, in quotations, when conflict is explored. So instead of really listening to the other partner, they're kind of thinking, well, I have it worse than you in this scenario. So so that sums up case 2.
Okay, thanks, Danielle. So in terms of where do we begin? So you will see that there are some similarities and some differences in how we might approach couples who have trauma experiences, and how we might approach individuals who have trauma experiences. So for those of us who are in the field practicing, working with individuals who have trauma, you will see similarities, you will see some differences. So first and foremost, therapeutic relationship, right? We want the therapeutic relationship is widely understood as being the cornerstone of all of the work that we do with any of our clients, regardless of modality, regardless of composition. It is that same way with couples. Now, with couples, of course, we are looking to build the therapeutic relationship with both partners, especially in partnerships where partners are very much at odds. There is significant conflict. It can often be helpful to let them know that, the relationship is the client, right? That's one way of conceptualizing it, that we're taking a team approach. Often I might preface by saying that, what the partners will see is me reflecting, offering empathy to each of them in turn. Right? So really connecting with one person's experience, conveying empathy, reflecting what they've said, and then doing that with with both of the partners, right? And this can be a really experiential way of having each partner see if they are at odds, or if there is a lot of conflict, or if they're having a difficult time understanding each other's perspective, what it is like to have somebody else reflect back, from a different lens, what it is that they're hearing and what it is that they're seeing, and always being mindful of how we balance that, so that we can build a trust and alliance with both of the partners, or all of the partners. And also externalizing the trauma effects. So, Danielle and I talked a bit before about the limitations around trauma discourse, right? Like when we talk about things like aggression, when we talk about avoidance, we talk about sexual dysfunction, right? Really also using language to externalize that, right? If avoidance is a result of fear, then, we're talking about when is fear present versus when is such and such partner avoiding, right? So being mindful of how the language that we use can either be stigmatizing, or how it can support people around what their experiences are. Of course, with all trauma work, I mean, with all psychotherapy, but especially with trauma, we're thinking of safety, right? So pacing, I mean, for instance, if somebody is speaking about the effects of their trauma, we are reflecting back, the tone, the pace, what we're hearing. Sometimes when couples are, when there's like a conflict ensuing in the session, right? How do we pace that? How do we make sure that we slow it down, come back to each point, be able to de-escalate what's happening? Also, when we're working with folks with trauma, we are engaging in grounding in the session at times, right? When people are experiencing hyperarousal, when people are experiencing dissociation, and we have an opportunity in couple therapy to also model how we do that to each partner, right? So if one partner has trauma, the other one doesn't, or if they both have trauma and they're looking for ways to support each other, we have an opportunity to model that. Also, as with all trauma work, we can work with the trauma impact over the trauma content, right? We're not eliciting disclosures. Sometimes we are managing disclosures so that people don't become triggered or re-traumatized, right? As in the case of the second case example, where both are first responders. This is an actual couple who are both the same type of first responder. So the content of their trauma is highly triggering to each other. So being mindful of those pieces, and also, taking negotiated timeouts and in the session. So that might be where we are, pivoting to redirect, to ground, to bring things back, to de-escalate what's happening in the session, and also modeling for our clients how we can enact boundaries, how they too can have negotiated timeouts in their relationship when there's conflict, and how to come back from that. Also wanted to just briefly note that from our perspective, we see an opportunity with the use of emotionally focused therapy. So, when we're talking about trauma, when we're talking about EFT, we are often talking about attachment, right? Attachment in the context of adult love relationships. When we're looking at underlying fears, the ultimate question, will you be there for me when I need you? Will you have my back? Such a pertinent question when we're talking about folks who have experienced trauma and don't feel safe often in their own relationships and in their individual lives. EFT looks at cycle de-escalation and restructuring interactions. And also EFT, has the acronym of RIS, right? So we are repeating the words that clients are using. If they are presenting us with imagery, we are building on those images to make what we're talking about tangible, right? We are keeping what we say simple. We're not using jargon. Even when we're offering psychoeducation, we're not inundating them with clinical terms, right? We are speaking in ways that are slow, that are soft, that are holding that energy in the room or the virtual room. And we're also reflecting back the client's own words and how they describe their experiences. I've kind of already talked about psychoed, but it's helpful. It's a huge part of trauma focused therapy with individuals. It is the same and even presents more opportunities or other opportunities with couples. So helping the survivor understand their experiences and helping the partner understand the survivor's experiences. Right. So always, naming and normalizing adaptive responses, right? When we can offer a little bit about, the neurobiology of trauma, what is actually happening in your brain? Why does your body freeze? Why do you feel afraid? We know how empowering and enlightening those pieces can be. And again, exploring when those adaptive responses, which absolutely make sense and are strategies for survival, when those pieces become intrusive within the context of the relationship.
Okay, thank you. And now we just want to get into communication. So we want to make sure that we're, noticing and naming triggers, right? So we want to notice and name those triggers when they come up in the therapeutic process, right? And we also want to, as Andrea mentioned, ground our clients in the present, right? So often we can end up going to the past, going to different things, and we just like to. It's just very important to be able to bring the client, which is the couple, back to the present and to ground them in the present. Also important to make sure that we're listening and reflecting what the client has said, so that we're just showing that we're actively listening, and basically eliciting in the moment emotional experiences of both partners, right? Responding with empathy, making sure that that we as service providers are responding with empathy to each individual story and their point of view, and sharing emotions as well is another big piece, just making it a safe space in order for the couple to share emotions, and just lastly affirming that relational safety, so that safety within the couple. And yeah, in contrast, and this is also in contrast to trauma experiences and reliving that trauma as well.
Okay, so we're going to attempt to illustrate how we would apply some of the pieces that we were just talking about to the case examples that we shared before. So we're going to start with Josh and Monique. This is the couple who both have experiences of sexual abuse, Josh in childhood, Monique in her adulthood. So naming and normalizing adaptive responses, right? So we see with this couple how they pursue and withdraw respectively, and both of them are seeking emotional safety from effects of their past trauma, right? So where Jeff has difficulty engaging sexually, his a way to keep himself safe is to withdraw, to retreat, to avoid, whether he wants to or not, right? That is an impact of his trauma and how that presents for him. So, behavioral avoidance, I'm scared to have sex. Right? And then what we see with Monique is how that, the cognitions, right? He doesn't want to have sex with me. The way that she interprets that, the way that that is laden with shame, right? So being able to normalize those responses and why they make sense. They make sense in the context of their past trauma. Right? We talked earlier about acknowledging and externalizing shame, right? So offering psychoeducation around the connection between trauma and shame, and how they were made to feel when they were victimized, and drawing a contrast between blaming themselves for what is happening now, right? Your abuser blamed you. They degraded you, right? They created secrecy. There was deception, and how those feelings and that profound experience can translate into an understanding, a belief in their current relationship that I'm inadequate, right? I'm broken. I'm defective. I'm letting my partner down. So I already talked at length about holding the energy in the room, right? Through our pace, our volume, our tone, of course, leaving space for emotion, inviting emotion, heightening emotion as we might with an EFT approach, or with many other approaches, and focusing on the impact of trauma over the content, right? So again, back to that attachment piece. Will you be there for me, right? Sometimes couples, when they arrive for therapy for the first time, it is often the first time where, they are able to recognize that the source of their conflict is not the content, but the process, right? So I'm sure most of us who, have a variety of different relationships, right? We're often not actually arguing about did you leave the clothes on the floor or whatever. It's more of like, how do you value me, right? What are you saying? Can I trust that you're going to do that you'll be there to support me or whatever, right? We can see that it's not the trauma. I mean, it's not the content, it's the process. And with trauma, that can feel so acute, right? Can I trust you? Can I be messy and raw and real with you and not feel afraid that you're going to leave me? Right? And as Danielle said, like working to affirm safety in the current relationship. Previous relationships may not have been safe. If this is a safe relationship, we want to highlight that contrast and open opportunities for this to be a reparative experience for them. Quickly, just referring back to Raheem and Janelle. So this is the first responder couple. So both of them have experienced trauma in the context of their work. Both of them have also experienced trauma in their families of origin, early emotional abuse. So for them, I mean, when we think about first responders, again, there is like specialized training, right? It is a survival necessity to be reactive, right? To be able to respond quickly, to be able to protect oneself, to protect other people around them, right? What that can look like in a relationship is aggression, defensiveness, hyperarousal in a variety of different ways, right? They in this particular couple, I don't think that they had realized before coming to the therapeutic process that, time and time again, they had been trained, they had been taught, they had learned in their life that if I don't defend myself, if I'm not extremely quick to react, I won't be safe, right? Like I can die if I'm not constantly on guard. And then in their relationship, it can be so damaging, right? Where vulnerability is not safe or acceptable, both in the culture of their families. So not talking about actual culture like ethnicity, but the culture of a particular family, and in the culture of a profession, right? For instance, policing, where, it might not be safe to be vulnerable, to talk about one's emotions, to talk about one's reactions to things, right? And that can be a learned behavior, often very intentionally. So acknowledging and externalizing shame, right? So like I had mentioned before, a loss of power and control. I wasn't able to help them, thinking about what may have been the trauma in their workplace, right? So often, what I've heard from firefighters, from paramedics, from police is the trauma is often associated around a particular call where they were too late, or they were helpless. They weren't able to help a person, right? And there was a horrific outcome, right? And the way that can translate in their own life and in their relationship. I wasn't able to help them. I can't help you. I don't know how to help myself. Or what I mentioned before around like the identity and persona of being a first responder, right? I could run into fires. Like I could I could testify at trials, right, and not skip a beat, but I can't even tell my partner how I feel. And there being shame and inadequacy and feeling a tremendous loss of capacity. I'm sorry, I'm repeating myself a lot. So as I mentioned previously, negotiated timeouts can be helpful when there is lots of conflict. Also, the way that we model for that to be okay, right? When things are high conflict, right? With this couple, I hesitate to use this word, but just to be illustrative, where things can be quote unquote explosive, right? Being able to see when things are escalating and take a mutually agreed upon timeout to ground, to self-soothe, and then come back, right? And also facilitated enactments. Also, where there is shame, there is difficulty at times expressing emotionality, right? So often, for those of us who work with couples, what we might see is a partner in the session is looking to you, the clinician, and saying, I do love my partner so much, and I want to be there for them, and I hear what they're saying, and I'm moved by this, and I want to try to be there for them, right? And you have these moments where you're like, in your mind, you're like, well, tell them, right? So that it, like EFT supports us in doing, is facilitate the enactment, right? Um, thank you for sharing that with me. Can you turn to your partner and can you tell them that? Right? And then what is it like? What is it like to say those words? And to the partner, what is it like to hear that from your partner? Right? So being able to hold that in the session. And again, focusing on the impact of the trauma over the content. So, looking in families of origin where there's patterns of lack of acknowledgement. There's no approval, support, and where there's like high levels of conflict and volatility, where partners may not be experiencing acknowledgement or approval in their relationship, where it might be very difficult to even communicate that, right? Also sometimes supporting partners in understanding, like almost having a script, right? So when I tell you that I don't give a what I'm saying is that I feel scared that you don't want me, right? Or when I look like I'm completely zoned out and I'm not paying attention to you anymore, it's not that I don't care what you're saying, it's because something in my body is telling me to run away. I feel fear, right? So understanding the impact of the trauma. And also, as with all couple therapy, there is a tremendous opportunity to model to partners how we convey empathy, how we offer validation, how we acknowledge what people say, in ways that feel meaningful, and how we reflect back. Right? I think, for those of us who are in this field, we still struggle to apply sometimes like the ways that we communicate with our clients. We might struggle to apply those in our personal relationships, and we have that advantage of knowing that these are the most effective ways to communicate interpersonally, and effective ways to make people feel heard and understood and seen. So really sort of weaving that into how we can strengthen the couple as well. Okay, so just by a very brief summary, we're almost done here. So what we have aimed to offer this evening are just preliminary approaches for selected themes, right? This are selected themes being sexual abuse and first responders. There's so much more to know, so much that we're still learning, but we've hoped to offer just, a few starting points. Want to really highlight the importance of the therapeutic relationship, safety when working, with anybody with trauma, the importance of psychoeducation, emphasis on how adaptive effects of trauma become intrusive in intimate relationships. As with all trauma work, wanting to be really mindful of the impact of shame, to certainly not reproduce that, but also nurture that and provide psychoed around where that comes from, and a contrast between past trauma and what is currently happening in the relationship. Focusing on process over content, and the importance of instilling hope. Right, even though some of the couples who have experiences of complex trauma can be so very complex, it can feel so very complex for them, that there is hope of being able to communicate, to learn, to support each other, and us reflecting the hope that we have for the folks that we work with.
Oh, wow. Well, thank you so much. Well, we've reached the end of the presentation, but I do want to open up the floor for some discussion and also allow for some question and answer.
Yes, why don't we go ahead and open up the floor to questions, and I'll share any of the questions that come through with you. Thank you both so much for that. It really helps to see it in a completely different lens. Just, what some of the things you're sending across, what you're communicating, and then what might be received by another person, and how we all assume that what we're sending is, vaguely what someone else is going to be able to see or experience or receive. And we really don't always know what they've been through that will be a lens through which they receive anything that we send. So really helpful perspective. Thank you. Let me see here. Okay, here's one. When I feel like my partner's not listening, I don't know how to communicate with them in that moment. I get upset and then I can't get across what I'm supposed to say. Any tips to help?
When you feel like the partner's not listening, and okay.
It feels like maybe they're feeling overwhelmed or dysregulated in that moment. And so maybe they're not also able to listen, and they don't feel like their partner's listening, but they're not sure what to do in that moment.
Yeah. I think it might be helpful to even check in with your partner and say, is this a good time? Is this a time when maybe we can take, a quick break? Like we said, sometimes you have to negotiate it, like retreat and say, like, did you want to sit in and we can come back to this and be able to, discuss it when we are both, in the mindset and mind frame when we're ready to listen and to collaborate and to have that effective listening piece. Andrea, any other points you're thinking?
I think for me, like when we think about this in the context of trauma, we're always wanting to think about safety, right? Safety and regular, like emotional self-regulation. So I guess, for the person who is seeking their partner, checking in with, am I grounded? Am I regulated? What can I do to, soothe my own internal state here, right? And then the question that comes up for me around the partner, which I might encourage them to ask their partner, is like, what's happening for you right now, right? Because this is where often we'll see one partner is like, you're not listening, you don't care, you're not paying attention to me, you don't attune to me, I'm not important to you. And because we are so vulnerable in our intimate relationships, that is the place we go, right? Like I think 10 out of 10 of us can be like, yep, that's where I go sometimes, right? So it's really wanting to check in with yourself and slow it down and be like, okay, what do I think is happening for them right now? Can I ask them what's happening for them? And if you are within yourself, grounded and regulated enough, being able to offer, how can I support you with what's happening?
Mm-hmm.
Also,
Yeah.
so that you can support me by hearing me when you're ready.
Mm-hmm.
Yeah.
And once you have that increased communication and that relationship where you have, built that security, then you will be more aware. And also through therapy, you'll be more aware of what's coming up for them, and you'll be more empathetic towards that as well.
Thank you both. Here's the next one. I know my partner is struggling. I want to be able to support them, but I struggle with my own fear of abandonment. It's almost as though I try to make their struggle about me. I don't mean to, but I can't stop that voice in my own head from being so loud.
Yeah. So often, so there's a few entry points for me here, right? This is something that can be brought to light in the context of like a mediated conversation, right? So if they're in therapy, looking at how both of their experiences of fear, abandonment, trauma, what's coming up, can be brought to the fore, because sometimes as partners we don't know that our partner is feeling that way. There's also opportunities here for some like good old fashioned cognitive work, right, around like what are our core beliefs, what are the what are the distortions that we have, like what are our thought patterns that make it, what I'm seeing then becomes about me. This person doesn't want me, right? Where is there evidence to support that? Is there evidence to counter that, right? um, and I think this is sometimes where like the like EFT script can be helpful, right? When I present this way, like fill in the blank, what I feel is this, what I need is this, right? It can be very simple. When partners can kind of hash that out with each other, there is better understanding, right? So when I approach you and you present this way, I will know that this is what you're feeling and what you're experiencing. You will know that when I make a bid for connection, when I approach you, when I'm trying to reach you and you respond to me this way, I feel afraid of, I feel afraid that you will leave me or that you're disinterested, right? Sometimes having those concretely to refer back to can help each partner understand why why there's emotional reaction, right? And why we react off each other's responses when both people are feeling a wound being activated.
Mm. And at what point do I decide if my partner's struggles are more than our relationship can tolerate? I try to meet them with compassion, and I know that they have a trauma history, but at what point is it no longer my job to make space for them and save the relationship?
It's hard to say, right? I
Yeah.
think it's like um one indication could be like when it's, starting to impact your quality of life, when it's becoming abusive, when it's kind of like, I hate to use this word, it's so cliche, but toxic, like when it's kind of becoming something that is more than something that is, slightly uncomfortable, but when it's something that's really starting to impact you in more serious ways, is one way that I think you can kind of know when it might be becoming, a bit too much, and when perhaps that person, maybe a good suggestion would be, if they're open to it, is for even them to go to therapy. Because while couples therapy is great, I think, and I think Andrea might be able to speak to this as well, I think what's also great is if the couple can also be in therapy, individual therapy as well,
Mhm.
because often there are their own individual issues that need to be worked on, as well as the issues within the couple. But
Mhm.
I'm going to summarize my perspective on this briefly. There, everybody is responsible for themselves. That's my summary. I found myself at times in, working with couples, long-term work with couples, where there is relationship and safety and all that good stuff established, where I found myself saying to, the partner who experiences the trauma, or who has the trauma experience, you're responsible for your own work on yourself too, right? Your partner isn't the only person who's carrying that. Earlier in our presentation, we used the term caregiver. It, it's it, we took that out of a particular piece of literature that we were referencing in our presentation, but it really begs the question: are partners in a role where they are caregivers to the person who has experienced a trauma, right? That's a really personal decision to make. There's one couple that I'm currently working with. They have been married together since they were teenagers. They've been together for over 3 decades. And now at this junction in their relationship, when he is finally receiving treatment for, long-term trauma individually, the other partner is finding herself asking the question, do I really want to be here? Like, can I endure this anymore? Right. So it's a consideration that can come up, I think, at any stage of the relationship, any stage of the therapy. And it's so personal. It's like, when does it feel too much? And also supporting the person who's experienced the trauma. And if it's both of them, supporting both of them to understand, while our partner conveys empathy and validates and supports and maintains safety and relate in the relationship, etc. At the end of the day, it's your life, right? You have to do the work on yourself too. We all do the work on ourselves.
That's a good point. And whether we do it in therapy or we do it for ourselves in other ways, right? That there's both individual work to be done in couples work and couples work to be done in individuals work often.
Yeah.
Thank you for that reminder. That's it for the questions that I have here. I want to thank you both so much. I know I'm going to be thinking about this more. I don't think anyone will go back and look at their relationship the same, right? Just in terms of like, how are we receiving and sending things? What are the experiences we've had that might, lead to interpretations and some of the same conversations or arguments or disagreements that we have with our partners, right? And what are the traumas that we've been through that we might want to think more about, each one of us. So thank you both so much for being so thoughtful about this. I feel like this has been helpful to both clinicians in the field and to anyone in a relationship at all. So thank you both.
Thank you so much, Dr. Ballou, and thank you, Danielle. Thank you for everybody who is with us and who is viewing this after the fact. Appreciate you so much.
Yes, thank you. I appreciate you guys for coming and listening, and hopefully you got some value out of it.
Absolutely. And for anybody who wants to be able to watch this again or share it with any friends or family, or who wants to connect for couples therapy, please reach out to admin@silmmentalhealth.com. We'd be happy to, share the video with you. You can see it on our website, or connect you with some support.